This is Hold My Stethoscope.
On. Hi, everyone. Welcome back to Hold My Stethoscope. I'm Brittany. Felicia is here. And if you guys have worked even one shift in the ER, you know there are things that happen that no one prepares you for. So tonight, we're joined by someone who has turned those exact moments into viral content. We have Gary, the ER nurse. Yay!
Thank you. I'm glad to be here.
Oh, welcome to
Yay,
the
thank you.
podcast. We're super happy that you were able to join us. It's honestly just an honor to have you. You have gotten a lot of following and definitely a social media presence just by like the things that you're seeing and doing and posting about. So like I'm so excited to talk to you and see how you've gotten into everything.
Me too.
I obviously did a little bit of homework here. So I know you started off as an EMT and kind of transitioned out of healthcare, then came back into healthcare. So kind of walk us through like your journey into healthcare. How did you get started in this crazy world?
So I actually did not start my career as an adult in healthcare. I got my start in radio actually in 1991
Oh,
and did that while I was in high school. And I still keep in touch with my teacher from back then. She's retired and living her best life in Florida. I went to college, studied broadcast journalism, and that's what I did for a number of years. I was a television news anchor, reporter, did sports, and then I got back into radio. And then I also went into newspaper as a columnist and sports writer. And then along the way, I met my first wife and she was an EMT and she was like, you should try this. This is a lot of fun. And I tried it and it was a lot of fun. I really liked helping people. And then I became a firefighter as well. And that was a lot of fun.
Wow.
Transitioned out of journalism and I transitioned into corporate communications, a lot more money. And then I got into higher education, just okay money. And then about when I was about 38, so this is like 2013, my wife ended up getting sick. And she's fine now, but at the time
Okay.
she was sick and I needed to take care of her. And while I was taking care of her, she kind of joked. She goes, you'd make a really good nurse. And I said, well, I love you. I would take care of you. I don't know if I want to take care of everybody else, but she's a CPA. She's very numbers driven. She had already run the numbers. You can afford to leave your job, go to school full time. We can survive on one salary. It'll be tight, but we can do it. And I was like, oh, you've really thought this through. She goes, you've got a background in you've got a background in EMS. You are looking for something different. And I thought this might be a good decision for you. So I said, well, I'll tell you what, I'll take some prereqs. We'll see how it goes. They went well. I applied, got into a 4-year university as a junior, did 2 years, graduated in 2016. I've been a nurse for almost 10 years now.
Well,
that is a
that's
crazy
awesome.
journey.
Wow.
Well, it's
Quite
kind of
the
funny
journey.
saying that because your wife is an EMT too, and she also took a completely different route, right? She's still in
So,
CPA.
yeah, so that was my first wife, and unfortunately, that
Okay,
did not work out. So,
Okay.
the wife that got me into nursing, we have been together. We've been married for 15 years and together for 17 years. So,
Okay.
but she's the one that I ended up, going to nursing school because of her efforts and her
Awesome.
planning.
Wow.
Yeah, you're like she had it all planned out. I was like, man, I wish somebody would take control of my life like
Right?
that and tell me what to do.
Just let her take the
I
wheel and
love
just
it.
steer in the right direction. She hasn't led me astray yet.
Smart
And are you
man.
still working as an ER nurse?
I still work as an ER nurse. I started my career as an ICU nurse, and
Okay.
then I ended up running a code where the hospital I was at. Whenever there was a code blue, one ER nurse, one ICU nurse had to go, and it was my
Okay.
night to be that nurse. Ran a code with a nurse from the ER. It was, a code blue. We did the best we could, but it ran really well. And afterwards, during the debrief, the nurse was like, have you ever thought about the ER? And I said, I have actually. And she goes, you should come work with us. So I applied, and then I switched from the ICU to the ER, and I've been in ER
Wow.
since.
How long were you in the ICU before
I
you made this transition?
did 1 year, 1 full year before I
Okay.
transitioned to ER.
Get a little critical care in there
Yeah.
before you hopped on over to the real side.
Did you always want critical care? Like you said how you've transitioned to ER, but was that always a plan with kind of having that EMT background, or were you just kind of stumbled upon it?
Well, so initially, when I graduated, I had applied at that hospital
Mhm.
for an ER position. I had just finished a year-long residency at a VA hospital. They had a program at the time called the Valor Program, the Veterans
Okay.
Affairs Learning Opportunity Residency. It's a paid externship.
Okay.
Typically, they tend to hire almost all of their externs.
Right.
This was a particularly difficult time for the VA system. There was a hiring freeze. So I had said no to that ER job offer because I was waiting for the VA to come through. And the
Yes.
VA, I had a friend who worked at the VA who was a few years ahead of me and called me one day, was like, hey, if you're waiting around for us, it's going to be a while. You might want to find something else in the meantime. So I went back to that hospital and said, hey, is that ER job still available? They said, no, but we do have an ICU job. If you would like it, it's yours. And I said, I'll take it. So critical care was always where I wanted to be, ER, ICU. I did my practicum in an ICU, so
Okay.
I'm very comfortable there. Coming from the EMS world, though, that
Different.
chaos and always
Different.
never knowing what's going to come through that door, that appeals to me. And that's what I
Me
love
too.
about it.
Me too. I can relate. I'm an ER, I'm an ICU educator as well as ER, but
Mhm.
ICU educator, and I'm not an ICU nurse. And I'm like, it's nothing like the adrenaline of the emergency room. Being in there and these patients coming in, you don't know what you're getting. Like it's
Mhm.
just I thrive off of it. Not everybody likes that kind of world. So I'm
And that's
glad
what
my
is
world there
amazing
is
about our
unrelated.
profession is that if that's not where you fit in, there are so many other paths.
Oh my God, they're all absolutely.
Mhm.
Absolutely. Wow, you've had quite the journey.
It's been a journey.
I'm loving this. I'm loving it. I mean, just the whole broadcast journalism side of it in itself. So you're able to bring the two together.
And that's why I started the podcast.
Yeah.
I love the radio aspect. I loved interviewing people, and now I can kind of take the best of those professions, talk about healthcare and share the stories, educate, and then use that broadcast journalism background to kind of, bring those stories to the forefront.
Okay.
Yeah, I think that's awesome. So, do you want to tell people about your podcast? Because honestly, I didn't really know about it, like just following you from social media until I like did a little bit more investigation. So plug away. What's your podcast all about?
So my podcast is called Beyond the Call Light, and you can find it wherever you find your podcast. I think I'm pretty much on any platform that you can get it. And I chose Beyond the Call Light because we all hear the stories that are in the press, the stories of, ERs doing amazing things, ICUs, nurses doing amazing things. I wanted to kind of take a step back and tell the stories that don't often get told.
Yes.
And so that's why I call it Beyond the Call Light. We all know
Okay.
about the call light. It's ubiquitous. Every hospital you go to, there's a call light going off, call bells going off. And so I settled on that name and I decided I wanted to get other people on to share their stories and to dig a little deeper, more for the healthcare professionals. I think it has application to the layperson who is not working in healthcare. I think they can still get something out of that, but it's more geared towards people that work in healthcare, work in EMS and deal with this on a daily basis. And I hope
Absolutely.
that's what I'm trying to get across and get
Okay.
some really interesting people looking for. I'm not trying to get Nurse John. I'm not trying to get Jen
Right.
Hamilton. I'm
Right.
getting the ones
The
that
real, the
not that
yes.
they're not amazing people, not
No,
that they're not
they are.
practicing
They make it
nurses.
funny.
They've got their own platform. They share
Right.
their stories every day. I want to share the stories of people that don't have that platform.
When you say like you go beyond it, are you talking about like the everyday nurse stories? Or are you talking about the person behind the nurse? Like what kind of angle are you going at with your podcast?
So one of the questions I get asked a lot is working in EMS is I am a EMT basic. I got my basic in 2003. I've never gone for my paramedic. So people often ask me, is that frustrating for you when you're in the back of an ambulance? I am not qualified in an ambulance to start an IV. I've started thousands of IVs in my career, but in an ambulance, I can't do that. And so I get that question a lot. Is that frustrating? So my very first guest was a gentleman named John Smith, who's a paramedic, spent 13 years as a paramedic, recently became an RN. So we got onto the show and really talked about the differences because there's always this blurred line like, well, paramedics are basically RNs in the field. It's not really
No.
true.
No.
Paramedics are trained for emergency medicine, life
Absolutely.
saving interventions. They don't, when they're trained, and he talked about this, like he didn't realize how much more holistic nursing is. Like we
Yeah.
look at discharge. What happens when that patient goes home? Do they have the resources they need? Those are things that nurses do that paramedics are not trained to do. They're not
Absolutely.
trained to think that way.
No.
So it's a very different pathways. I wanted to like that's an example of going
Okay.
beyond what most people understand about those two professions.
I
That's
can
awesome.
relate. I too am a EMT, so I could relate to that basic. So I all the millions of IVs I've done, I wouldn't be able to do in the back of the truck as well because that would not be my role in that
Right.
setting. So I can relate to that.
Yeah, and it's so different because you probably sort of know this, but being an ER nurse, I feel like we're almost siloed in a way to the ER. Like our brains are just ER based. And it could
Yeah.
be sometimes hard to see a more global perspective from other people. So we've been trying ourselves this kind of season to really broaden that horizon. We talked a
Right.
lot in our
Mhm.
first season about specific ER and being very ER based, but we really wanna take, like, this own podcast to a different level. We really wanna get to know people and really share throughout the nursing spectrum because we aren't just siloed in the ER. There's so many interconnected pieces within nursing and
Right.
that we're a big community and not just siloed into professions or that things. I love it. I can't wait to kinda check out some more of your episodes. I did see that you had the Blakery content on,
Yes, Christopher Blake, great guy.
yeah, so I'm excited because he's actually coming on our podcast too,
That's
so
awesome.
I'm really excited, and I've been doing a lot, I also oversee the pediatric ER, so, like, I've been doing
Okay,
a lot of pediatric education
perfect fit.
things, so I'm just really excited to, like, be having these, like, conversations and these connections. It's
Yeah.
so cool what we have in nursing and how social media has now connected us
Mhm.
to these different people. Like, I mean, if I didn't go on TikTok, I would have never found you or any of
Right.
the other people who are just doing really good things for the nursing community, really spreading education and
Mhm.
really this community status. So I think we're taking a huge step forward in what we're doing. And that
That's
was my
great.
little that was box. All right. Let's kind of so we kind of developed into your ER. How did you kind of start this path of that social media and kind of that
Mm.
aspect of your career?
So for, um, before I became a nurse, I worked with a buddy of mine who has a company where they do websites, and I mean, they've been around for like 20 some years. And so he brought me on. One of the things that I did for my employers when I was worked for a government contractor and I worked for a university is social media. And search engine optimization. When that first came out, I went to conferences all the time and I would work with clients to do that. So I had some basic understanding of how that worked, like how to optimize your content so that it would appear in search engines. So when I decided to get into social media, I've been on, I'm 51. I've been around since the dawn of social media. Like that was in my 30s when that kind of evolved.
Right.
So I've been around. I was one of the first people on Tumblr. I had one of the very beta editions of Gmail. So I've been around a while and I've watched it grow. I've watched all these platforms come and go. They
Right.
did great, then they failed. I think what I've learned about social media is you have to be, it sounds cliche, but you have to be true to yourself. If you try to be something that you are not, people are going to see right through that. And
Absolutely.
so one of the things that I really try to focus on is like, I'm me. What you see is what you get. What you see on my platform, the things that I post, the people that work with me are going to go, yep, that's how he is. That's what he's like in real life. I try not to put on a persona that is not authentic. And
Exactly.
when people meet me and I've had that happen where there's a nurse that works in my hospital, did not know that I worked at that hospital. I take a patient up and she does this like, oh my gosh, you're Gary, the ER nurse. And I was like, yeah, yeah, that's me. And she goes, I didn't know you worked here. And I was like, surprise, I work here. But that interaction, like I wanted her to walk away from that going, yeah, that's literally the same guy. Like he's just down to earth. That's what you see is what you get. And so I think audiences are smart. They're
Yeah.
going to see through that. And if you are anything but authentic, they're not going to trust your content. So my advice
Right.
to anybody wanting to build a channel, be yourself. Stay in your lane. Talk about the things that you're good at. Nobody expects us to be good at everything. I'm
Right.
an ER nurse. Somebody starts asking me questions about oncology. I'm like, that's not my wheelhouse. We need to get an oncology nurse on here and they can talk about it because that's what
Right.
they specialize in.
Right.
So,
Yeah, we were actually last episode, we were kinda talking about how, nurses' side hustles because, I mean, it's this day and age, we all need a little extra that our nursing careers are just not covering. It's tough out there right now. And we were talking kind of about social media and how people can kind of develop other side businesses. And one of the things we had said was, you have to kind of be that subject matter expert in what you're saying because people have
Mhm.
to believe what you're saying and have some context behind it and also being passionate about what you're talking about because there's 100 nurse joes just out there saying whatever, but that
Right.
person needs to be credible, so you buy their story, but also personable and passionate. So that was our advice last week, so I'm glad you kind of
Mhm.
led it with that too.
Absolutely. And come clean when you don't know something. I do lives. I go live almost every morning around 6:30 during the weekdays. And I've got kids, so it's all dependent on if anybody's sick or anything like that. But I
Right.
try to go live and be consistent. And people ask me questions all the time, and I'm like, I've never heard of that. I don't know what that is. That is not something I see as an emergency nurse. If I worked like in another unit, I would probably deal with that on an everyday basis. But when you don't know something, tell people I'm getting ready to start a side hustle as a clinical instructor for my alma mater. So I'm going to have a group of brand new nursing students going through fundamentals. And I'm going to tell them, like, look, I'm not a med surg nurse. We're going to be
No,
going out onto med surg. There's going to be procedures that I haven't done since, when I was an ICU unit and got floated to a med surg unit. We're going to learn together.
there you
Okay.
go.
And that's what you have to tell people. Like you have to understand, they have to understand, like, I'm not perfect. I don't know everything, but you know what? We're going to learn this together. We're going to muddle through this together.
100%, Gary. I'm the same way. I'm not an ICU nurse. I
Mhm.
walk into a hospital and they say you're gonna be the educator for an ER and ICU. I'm like, I don't have any ICU experience. I know we sent patients to the ICU, and of course, I know that we would always stabilize and get them to the ICU, but I'm not an ICU nurse. And I walk into this world and I tell every ICU nurse and the manager, do know I am not an ICU nurse. I need that to be clear.
Right.
I am more than willing to work on learning their equipment with them. No shame in my game, but you need to know walking in here and what you're getting.
That's
You're
right.
getting a veteran ER nurse, and that's the world that I know. It's totally different for me, but I am open to learning
Right.
whatever it is that you all are willing to teach me. That's what I told them. And they give me the utmost respect for that. So you're absolutely correct. Just being yourself and being real, and people respect that more. They
I
just do.
agree.
Well, and kind of going on to that, so when your social media was kinda taking off and you kind of started to get into that viral type of thing, how did you kinda keep it I don't know, men are better at this in general, but, like, from going to your head and not maybe just doing that full time because you still work at the bedside, so, like, how have you managed to kind of do both things and then, again, pick up a side hustle, but I get that, so
So I think having worked in television and been a local celebrity. When I worked in TV, I couldn't go anywhere in that town without people knowing who I was.
Oh,
That was
wow.
the only local TV station. So if anybody watched local, and this is before YouTube, this is before like the internet was real big. This is the late 90s. And so everybody knew me. You had to
Right.
be on your best behavior because you represented the TV station. Your contract was tied to your behavior. If you go
Mhm.
out in public and start acting a fool, and that gets back, they can terminate your contract. And now
Right.
you're going to have a hard time finding work. So you always had to be on your best behavior. You also had to have a thick skin because whenever you go to a game and you're representing, people don't like the way you cover something, they're going to let you know. If they don't like the way you are the anchor and how you deliver the news, they're going to tell you. And you just got to let it roll. Like, hey, I appreciate your feedback. I'm going to try
Yep.
and do better. And they don't care that you want to do better. They just want to get under your skin. So I think that helped. Being older helps, I think, as well. Life experience helps. I've made a lot of mistakes. I understand mistakes are part of life. I've made mistakes on social media. The important thing about that is to come clean. When you make a mistake, own it and say, hey, I made a mistake when I said this or when I did this. Thank you to so and so for calling
Or
me out on that.
absolutely.
We're going to
Give them
fix this.
credit.
And if that ever happens again, please call me out. I try to make every effort to make sure the information is factual as best I
Mhm.
can, but I will make mistakes. Call me out on it and we'll fix it. And I think that's probably what, when I got into social media, I had to keep that in the back of my mind. Like, people are not going to like you. Doesn't matter. It's just like real life. Not 100% of people are not going to like you. Accept that,
Nope.
own it, move on with it, and keep doing your thing.
That's right. You are absolutely right.
Mm.
That
I
is
think
nice.
what's kind of kept you at the bedside? Because obviously you said you're, a little bit older here and that gets, I mean, wearying, if you've been
Yeah.
in a nurse or any kind of nurse for a long time, like the bedside is hard. So like how have you managed to kind of still be at the bedside 10 plus years later?
I think having seen what has happened to the nurses that I've worked with that have gone to management has really
Oh,
deterred me from doing that.
Oh,
Um,
most definitely.
you know,
yeah.
just in
Yep.
terms of their mental health, in terms of their like exhaustion levels, it just doesn't look like a path that I would want and all of the things that they have to deal with from the top down. Now, that being said, I've had really good managers and I'm grateful for what they do so that I don't have to do that. I think
Right.
that's one thing that has kept me at the bedside. I like taking care of patients. I'm in the very unique position that I get to care for veterans. I grew up in a military family.
That's
Taking
awesome.
care of veterans is not it's a job. It's great. It's a great job, but to me, it's more of an honor because most
Right.
of my family served. So it's my opportunity to serve those who served us. And I take great pride in that. And so that's another thing that has kept me at the bedside. If I was at a public hospital working level one trauma like I've done before, I don't know if I'd still be bedside if I had done that for a full 10 years. But the fact that I get to work with veterans, I think, is what keeps me at the bedside.
I
That's
like that.
yeah,
I can
that's
understand
awesome.
that completely because, working in a trauma center, it's hard. Like at this point now, I mean, granted, I did it for 20 years, but it was different. You know what I mean? Things have really, really changed. I don't think if I had started 10 years ago, I would be able to do it in like a trauma center now for 10 years. You're
Yeah.
lucky if you get people to stay for 2 years now.
Right.
Like
Yeah.
Yeah.
it's not easy. It's not.
No.
So
Well,
I commend you and I love that.
I think level one trauma during COVID, I think aged a lot of nurses because, on working level one trauma is stressful. It's taxing physically, emotionally, mentally. I mean, it just wears you down. You throw that in with a global pandemic and you've got a 4-bed assignment and every single one of them is COVID positive, which
Yep.
happened regularly, you
Yep.
know, that like right before COVID, which was what, 6 years ago? 6 years ago, this was all brown. All of this was brown.
I
1
bet.
year
I
1 year
bet.
later, all gray.
Oh,
Like,
great.
that doesn't happen in a year for most people. That's a COVID,
Boy.
ER nurse in a level 1 trauma center.
Oh,
Yeah,
yeah.
that's
Yeah, that's
yeah,
true.
But
COVID.
anytime I bring that up and I'm talking to other nurses that did that, they're like, "Amen. Yep,
It's just
absolutely."
it's so true. Oh gosh. It was
Like,
a
we're
lot.
laughing about it, but we're like, "Mhm,
It was
yep,
a
makes sense,
lot.
yep."
It was a lot. It
We
it
It was
was it was it was the toughest thing I think I ever did in my entire
Oh,
career.
hands down it was.
Yeah, it's rough. That was pretty rough. So,
I mean, and that's a source of, and I don't use this term lightly at all. That's a source of PTSD for a lot of people, myself
yes,
included.
it is.
I
Yes, it
cannot
is.
wear a PAPR anymore. I cannot, you will not put that mask on me anymore, ever again. I
I don't
cannot,
blame you. I don't.
I will have a full on, Robbie from the pit panic attack. Like when
There
I
you
watch
go.
that thing, like I'll tell you right now,
Put you
when
in the corner, honey.
I broke down because I was like, yes, yes, people can see it now. Like that is
Yes,
what we deal with. And I was
that's
so glad they
exactly
brought
what
that
we
up
do.
because like it really did. I was in a corner crying watching that episode.
Exactly. Yep. Terrible.
How
Yeah,
do
that's
you
pretty tough.
kind of speaking of that, how do you relate to I mean, I'm sure you're in with a lot of healthcare people, but how do you relate to, like, friends or family or people who don't have that knowledge? You said, like, your wife now is, a CPA, like, how
Right.
does that work when you don't have somebody who understands it? Like, how do you have those relationships with people who really don't get it because they haven't
Yeah.
been
Don't have a good answer. I've not figured that out yet. I think you can tell them and they do their best to understand
there?
and
Mhm.
they're sympathetic. But, and to some degree, I think they can have some empathy. Like the concern that my wife had as a parent, coming home and one of your kids getting COVID. Because you got to
Yeah.
remember, in the early days of COVID,
Yeah.
we didn't know what was going to happen.
We
We
didn't.
started up in New York and all you saw was the news stories, bringing in the trailers, ice trailers.
We
They
didn't
had so
understand. We
many.
didn't know
We
what
had
was
no idea, and so, like, when you hear about somebody that got it, and I was the first one to get it at our hospital
Ugh.
as a we
oh,
weren't even
wow.
masking yet. We didn't even know it was really down that far yet. I had a patient. It was the 3rd visit in 5 days Third time they came in, SpO2 60% on room air, happy hypoxic, looked completely fine. And we were like, oh, that's what they're talking about. It's
That's
here.
what they t
Yeah. So, and then like 2 days later, we got the test result back. They called me and said, hey, your patient tested positive for COVID. And you're like, oh,
I'm
that's
about
bad.
to die.
Right. And then I got it and it was bad. Like it was really bad. Like I was on oxygen. I had double
That's
pneumonia.
how I was.
Yep. My coags were like off the chart. They
Yep.
had no idea what was happening. I'm proning. I was 88% on room air. So they had to give me home oxygen. So I think that scared my wife for sure. Right. So I think they have empathy from that standpoint. But in terms of going back to work and then dealing with subsequent wave after wave, I don't think they can ever fully understand that, no matter
No,
how much we explain that.
no, they can't.
Right. So the love is there, the
Yes,
compassion is there, the sympathy is there. But in
yes.
terms of when I tell my wife like I get PTSD, like she hears it, but I don't know if she truly understands what it
Exactly.
feels like to experience that. Like when I heard the PAPR for the first time in like a year, like I did, like I panicked.
Yeah.
So I don't
That's
have a good answer. It's a work in progress. Therapy. A good therapist is
No, you're right. Yeah,
Well,
absolutely.
it is me and Felicia both have non-medical significant others, so, like,
Yep,
we also kind of relate to that, and I feel like in a way it's kinda nice because you have somebody that doesn't bring that you don't bring that home necessarily with you. You have kind of
Right.
a
right,
release where you just kinda hopefully can leave things at the door and you have
Yeah,
friends or other things you talk about this life with, but I
right.
feel like it's actually been a good thing is
Can
not
be.
being
Yes,
with
you're
somebody who's
absolutely right.
field.
yep. Totally
We're like
you
1
get it.
degree of separation away from that
Yeah.
trauma.
That's
Yeah.
it.
Yeah, it
Yep.
gives you, like, that little, like, space to be, like, that safe space where you're not coming home and constantly being, like, just talking about it more and more,
Right.
so I
Mhm.
think there's pros and cons to, having partners that are healthcare workers versus
Right.
n
You can
Absolutely.
never talk about your day if you with somebody that is a healthcare worker. They don't wanna hear it. It's like I go to work, I gotta deal with, I come home, we talking about it. Nobody wants to talk about it. See, our
or you're, like,
story
one-upping each other, like, your stories,
Right.
you're
absolutely.
one-up
See,
each
we us
other.
talking
You
to
think
our
that's bad?
partners or significant others that have no idea what we're talking about. I'm telling them some crazy story that happened, and they like, I don't know how you deal with that. But yet it's like, oh my God, let Felicia tell you this story that you know what I mean? Because even though they don't really get it, it's interesting to them.
Right. Yeah.
So
It's the
yeah,
juicy stuff.
it is juicy. I mean, we've dealt with some great stories. I've had some great stories. The
Yeah,
things.
and yeah, because in your career, you've done it twice as long as I have.
Oh my God. Oh my God.
I could
And
write a book. You could write an encyclopedia series.
like, something's wrong with us as people that wanna keep dealing with this kind of stuff, but it was just so drawing, you wanted to go back, it was never a dull moment, it didn't matter, like, no 2 people who came in with the same complaint was it the same, and that's what I loved about it, and I'm very grateful for those who do bedside nursing, med surg floors, ICUs, whatever, but I
Right.
love the camaraderie of, like, people coming and going, and the
Yep.
next one's going on here, this one's crashing over here, this one's and me giving them the death stare. If nothing's wrong with you, I need you to stay in that room. I miss that life sometimes. It was fun, but you get old, you get older. Now I'm like, I'm too tired. I can't keep doing this.
I'm
You know.
I'm getting there.
Oh God, I'm like, I can't keep doing.
It's hard though. It's hard being at the bedside every day. Like, I know you've probably seen it, but there's definitely been a shift after COVID with
Yep.
how people dealt with it. And I feel like still there's remnants of people dealing with that and the effect that it's had on bedside nurses. Like, nursing's always been tough, but it's been a lot harder since COVID. What's
Right.
kind of you said you switched over different hospital systems. Do you
Mhm.
feel like that's also kind of reinvigorated you being able to take care of veterans as opposed to that community hospital? And kind of like, how has that helped you stay, I guess, not burned out? Like, how have you been able to kind of maintain
Right.
that?
Yes, you're no, that's a great question. I think moving to the VA system, which that's the VA that I did my residency at. So I think that really helped. Had some familiarity with it. In fact, some of the people that were in the ER when I was a student were still there.
Okay.
That's
And
amazing.
that definitely helped.
That's amazing.
And going to the VA, things are a little bit different. It's a
Yeah,
federal facility. The way almost all of their patient records are all together, unified. Their med recs are done. Those are things that extra layers of stress we don't have to worry about. And our
absolutely.
nurse to patient ratio is way better. And so that allows you so like our ER is 1 to 2, 1 to 3, 1 to 3 on a bad day, 1 to 2 usual. Now
What?
the trade-off is we had to give up our FTE full-time employee position for ward clerks. So we don't have ward clerks. Your charge nurse is the one that has to handle all of that responsibility. Fair trade. We'll take it every day of the week and twice on Sunday.
Yep. Yeah,
Not
yeah.
that I don't value the ward clerks, but if that gives me an extra nurse to take 2 patients or 3 patients instead of 4 patients, those veterans get better care. Now that
Absolutely.
may not be the case at every VA.
But
At our VA, and you know what? We have veterans that bypass other VAs and drive hours to get to us because they feel like they get better care. So we'll take that. We'll take that all the
wow.
That's amazing.
Wow. That is.
Yeah, that sounds like you found a place where you're actually able to
That's
care
good.
the right way. You know what I mean?
Right.
What
It's
are some
not
lacks
sucking
of
the life out of you either.
Exactly. Well, and if you have 4 beds and you're in a busy level 1 trauma center where you've got 6 sick patients, think about all the tasks that don't get done because
Exactly.
you just don't have time. During COVID,
Exactly.
you get a COVID patient who is septic, you're in that room for a solid hour
Oh,
and a half,
yeah. Oh, yeah.
EKG, blood cultures, lactics, 2 lines, doing all that stuff, and
They don't come out until
right?
you're done.
So 90 minutes, you've got 4 patients. You're doing that for all of them, and that's half your day.
Yep.
And, going down to like 2 or 3 patients, that is
That's
you don't miss
amazing.
anything. Everything gets done. Those veterans get the care that they deserve. And I tell you, I felt really hesitant to share that with other people in the beginning. I felt not ashamed, but I felt like I wasn't a real nurse.
No, you are.
But what I understood was this should be standard of care at every ER,
It should.
but it's
You're a
not
smart nurse is what it is. You're smart. That's it.
because
That
most hospitals are owned by corporations. Corporations put profit above people, generally speaking, in this country. That seems to be
yep.
the case. And
That
so they're
is.
going to operate with minimal staff,
Yep.
maximize their profits.
Yep.
And that's when we start losing patients and things don't get done or things get missed.
Yep. And you're absolutely right.
Yeah.
Yeah,
Wow.
I do wonder, like, this isn't obviously to call out any specific healthcare system, but you kind of hear kind of the two sides when it comes to like that federal kind of healthcare, because, and I don't know if it's changed or not, but like you hear the stories, right? Can't come,
Yep.
if they're true or not, but like veterans are waiting years to be seen by their primaries, or there's no psychiatric care for them and they're not being seen that way. I guess in your specific area, how is that kind of care? Because you said your hospital care is great, but do you have like good outpatient and follow up care in your area?
I think for the most part, we do. There is definitely challenges with
Oh,
getting
yeah.
follow-up care. Now, one of the things that we do at our VA, and again, this is our VA. I don't know if this is
Yeah.
other VA. We have in the ER, we have a position called a nurse navigator.
Oh my God, that's an amazing role.
Right. So the way our nurse navigator works, so if we discharge a patient and they put in a consult for neurology, they put in a consult for whatever specialty, there's a part on the discharge where we flag the chart, automatically gets sent to the nurse navigator. So when they come in the next day, she's going to look, okay, I've got these 5 cases. They need to follow up. I'm going to make sure that that call happens.
Nice.
Oh,
So,
wow.
so they follow up to make sure that those appointments get made. And then whenever we have a veteran call that say, I was not able to get in with my primary. I need to see somebody, blah, blah, blah. I get on the phone with the nurse navigator. Hey, I've got a veteran on the phone that is having trouble. Do you know somebody? Can you make a call? That's our hospital. That's our ER. I don't know if that's across the board.
Oh, wow.
But we do the stories that you hear. Yes, there is definitely some truth to that, especially when there's what we call like care in the community. Let's say we don't have a specialty, neurosurgery. We don't have
Right.
neurosurgery. We have
Right.
neurologists, but
Right.
not
But not
neurosurgeons.
neurosurgeons. Right.
They got to go to an outside facility. Those
Okay.
appointments can be tough to make, not necessarily
But
on our end. That is on their end because they're so busy. So that's where it can get a little challenging.
okay. Okay.
It's
Overall, the VA is pretty good about making sure they have those specialties available for the
Right.
most part for their for veterans.
And
I
if we
think
don't
the
have it,
most
we will do care in the community consults and get them with local
that's
specialists
awesome.
as best we can. Yeah. And in some cases, we'll transfer them to another VA that does. It's not always the best.
Wow.
It's not always the best option because a lot of times they want to stay local because they got family. They don't want to have to go 4 hours away.
Right.
But in some cases, if that's the best option, then we will do that.
Awesome. Wow. That's awesome.
This is probably a really tough question that I'm going to ask next. But speaking about healthcare systems, I'm at such a point right now, too, in my career. Like, I've been through it all, and I don't have a problem with any really healthcare system itself. I have a problem with corporate healthcare. And kind of like what you were saying, there's so many barriers because medicine has become a business. And
Correct.
there's so many barriers that prevent nurses across the country from being able to do what we really want to do. And I know you're probably not going to have a solution, but what do you think about that? What do you think we as nurses in the community can do to try to help move that needle? Because there has to be a change. There does. We can't keep doing the things that we're doing right now. Like,
We're
we are in
losing
a
them.
broken system.
Yeah.
So that's a very good question. And I actually do have an answer. But
Yeah.
there is no, but it requires a lot of work on a lot of different people's parts. So 10 years ago, I was on Capitol Hill, almost 10 years to the day. I was on Capitol Hill and I was lobbying for nursing. As a senior, I was chosen to go with the dean of our college to Capitol Hill as part of the student nurses, National Student Nurses Organization, where we went into offices and we talked with legislators. We went to conferences. We presented our case for safe staffing for many things. Nurses make up an estimated 3 million in this country. 3 million nurses. If we came together, we would be able to have one of the strongest lobbying groups in the country. Now, we can go down this pathway and talk about the ethical nature of lobbying groups. The fact is, that's how things get done right now in the current political climate.
Right.
If nurses can get together and form a cohesive unit with a lot of support behind it, and when I say support, that means financial support because that's how lobbyist groups work,
Right.
we could affect change at the national legislative level. State level is great too. Like we're doing great things in terms of getting, legislation passed in various states that mandate safe staffing ratios. At the national level, however, we are very weak.
Yes.
And I think that is where we need to come together. Who's going to lead that charge? It's not
Right.
me. Like, I am not that person, but there are people out there that have a bigger voice that can, if Jen Hamilton told us all to jump, we would ask how high
Mm-hmm.
and where are we jumping? If she told us to meet her in DC and we're going to go, I guarantee you there'd be 100,000 nurses there in the next month. So finding the right people to do that is what's going to be the important part. But the answer to your question is we need to come together 3 million strong because that's hard to ignore when you go to Capitol Hill with a lobby group representing 3 million people.
Mm-hmm.
I'm with you. I'm gonna bring the picket fence with you and go because I definitely care about this profession. Like, it's burned me a couple times, but like I still care about nursing. I care about
Oh,
people. And, like,
absolutely.
I just see this trend over the almost 20 years I've been in healthcare, and
Mhm.
I hate kind of the trajectory that corporate and kind of that business model is pushing us to because it is, and I hate it so much. Like, it's all the focus is truly on the numbers. And, everything's coming down to being like, how quickly are you getting patients through? What are your contaminations with this? What's your length of stay? Like all of these metrics. And if people aren't meeting the metrics, it doesn't matter the care that was provided. You didn't meet the metrics, so it wasn't good
Nope.
enough.
Right.
So it's hard to fight a system that's fighting against you. So yeah.
Right. But
Soapbox.
until at the national level, until they remove profit
Yeah.
from healthcare, it's going to be difficult to change those things because
Yeah.
when you have a billion-dollar hospital conglomerates, their priority is not patient care.
No,
Their
it's not.
priority is to the shareholders, the
Yep.
stakeholders, the
Yes.
board. So until you remove profit from healthcare in this country, patient care will never be the number one concern for these
Nope. It
companies.
won't. Nope.
And even the not-for-profit, that is a name
Oh,
only.
yep.
It,
It's the name only.
It's a
Yep.
technicality.
Yep.
Don't let anybody fool you that, we're a not-for-profit.
Right.
Okay. And why is your CEO making like 3 million a year?
Exactly.
You took that profit and you just built it into the packages.
Correct.
Mhm.
Yeah. It's crazy. All right. Let's move on to just another kind of subject before we kind of start wrapping it up. What kind of advice, or I guess advice is probably the best word, that you have for people getting into nursing, getting into ER nursing, or even wanting to get into social media and building kind of that way? What would you kind of tell those groups of people?
So when I do my lives, inevitably somebody asks a question similar to that. Like, I'm thinking about nursing. What advice would you have? My advice is you have to have passion for people.
Right.
You have to want to help people. It is not a job. It's like teaching. You don't just teach because it's a job. You
Right.
have to be passionate about that. To be
Right.
good at it, you need to be passionate about that. To be a good nurse, you need to care about people. If you have that, then I say go for it. It's hard. School's hard. Nursing school is one of the hardest things I've ever done.
Isn't it? It's
Yeah.
the hardest thing ever. It really is.
And then when I tell them, when you go to nursing school, these are the things that I think will help you be successful. Find a good study group. And I mean, not the ones that you get along with. That's good. The ones that are going to make you a better student, the ones that are going to push
Absolutely.
you and they're going to hold up their end of the bargain. Use Quizlet.
Use Quizlet.
I
Yeah.
love Quizlet. We would divide up chapters. I'd take chapter 1, 2, you 3, 4, you 5, 6. You do your notes, put it all in one big study guide. You're still responsible for the reading. You still have to read all that, but we can get different perspectives. Quizlet
Okay.
was a huge help for me in nursing school.
Nice.
And then, do I need to go to med surg when I graduate? No. You don't.
No. No,
You go to
don't.
whatever unit you feel drawn to. You want to go to dialysis?
Absolutely.
Go do dialysis.
Yep.
Maybe your parents are on dialysis and that's what you want to specialize in. Go for it as a new grad.
Yep.
If you
Yep.
want to do ER, we'd love to have you. I will
Yep.
precept you myself. You want
Yep.
to go to the ICU? I started in the ICU. I'm all for that. Again, med surg is a wonderful unit. You will learn time management. You will be running all day. Like
The whole day.
the whole
Okay.
day. You will
Everybody's up, walking, talking on those call lights. That's why you call yourself a call light guy. On those call lights, it's from that man's search floor. They live on it.
Yep. And
They live
med
it.
surg is, I mean, it's a very noble,
Hard.
specialized, difficult nursing specialty.
Yes, it
And
is.
I have a lot of respect for the med surg
Me
nurses.
too.
I knew that's not where I belong.
Me
Critical
too.
care was where I wanted to be, and that's where I ended up. And that's what I tell nursing students. Where do you want to be? Do you want to start in hospice? If that's what you're passionate about, go do hospice. I love the hospice nurses I've
Yep.
worked. They're
Yep.
great. Palliative care, it doesn't matter. Find what you're
Pediatrics,
passionate about.
OB. There's a ton of places to go.
I will definitely not do OB.
Me either. Me either. But I'm saying if that's what people say they want to go, by all means, go right.
I've delivered 3 babies in my EMS career. I've met my quota. I'm done.
I don't blame you.
3 steps, you're
Listen,
out. That's it. No
I don't
more.
want to deliver no babies. Listen, as ER nurses, every time they tell somebody coming in there and we all freak out.
It's like
Every single time. I don't care how
in the
many
wheelchair
drills we
holding,
do.
we're going down the hallway.
Yeah, nope. You
Hold
get
it.
her across the street. Across the street, please. So yeah, that's not my thing, but thank you for all those who want to do it. I love it.
And then your last part of that question was social media, getting into social media. Again, just be yourself. Talk about the things that you're passionate about. If you're not familiar with it, if it's not your specialty, it's not that you can't talk about it, but you need to take it from the approach and preface it with like, I'm learning this. So this is what I learned about this topic today. I would love your feedback. And you'll get a lot of feedback. The other thing I tell people is trust but verify. I got burned on this as a new grad. You will get told a lot of things by a lot of people that you would trust outside of the healthcare profession. A doctor
Yes.
tells you something, you're going to trust it. Resident tells you something, respiratory therapist, it doesn't matter. Trust but verify. It's not that they're lying to you or telling you information incorrect on purpose. Things change. These people that have been in nursing for 30 years, maybe it was true 25 years ago, but things change. So
It was
take
true
that
last
information,
year.
process it, say, thank you, I appreciate that feedback. And then you go look it up to make sure that's accurate. Because
Thank
if
you.
you
Thank you.
regurgitate that and somebody calls you out on it, guess who's going to look like the fool? Right. So trust but verify.
I like it. I
That's
like that.
great
A lot.
advice.
That's
That's
great
great
advice.
advice. Yeah.
I do. I like that a lot. Yeah.
My last kind of question is I also transitioned as another side hustle into doing clinical instructor. Like I took a clinical group as well. So
Awesome.
how did you kind of start or want to go down that path as another kind of side hustle?
So I've been an EMS preceptor for years. I have been a nurse preceptor for many years as well. At my first hospital that I worked at, when I went from ICU to ER, after having been in the ER for several years, they came to me and said, "Would you like to be one of our preceptors for new grads?" And I was like, "Yeah, that'd be great. Nursing students and new grads." I said, "Great." And of course, then COVID hit. I got my first student and, doing their practicum. And then COVID hit and nobody got a student.
Nope.
Students did
They
nothing.
learned on the
And then once COVID kind of settled down, I started getting like new grads that would come in and do rotations. And then when I came to the VA system, I was like, "Where are the students? Oh, we didn't let students in after COVID. We've not let them back in." I was like, "What are you talking about? We need to get them back in here." So they're working. We got students doing med surg rotations. We are not yet down to the ER, but we're working on it. I'm working with the education department to get them back in. I will be soon a certified preceptor for the VA. I'm going through that training. And then one of my coworkers actually got one of the clinical instructor jobs for one of the campuses at the university. It's my alma mater. And she came to me, she goes, "They have an opening for the campus near you. I think you'd be a great fit. You should apply for it." I was like, "Oh, sure, I'll do that." Applied for it, interviewed, they offered, I accepted. I'm super nervous. And I was like you, Felicia, I told him, I was like, "I have zero med surg experience. I've never been a med surg nurse. I'm not sure I'm the right fit for this job." And they were like, "Neither were we. Don't worry about it." One was like a neurotrauma ICU nurse. The other one was like an ER nurse. Like, we weren't either. Like,
Okay, there you
just,
go. You're going to
like,
learn them bed baths all over again. There you go. Learn. That's right. Get back into it. Bed baths, those corners on them sheets. Listen, there's some things you just got to freshen back up on,
That's
but
right.
it's in there.
Yep.
It's in there. Tell
Right.
them. That gate walking, I can't stand it. I can't stand it. But you know
And that's
what? Got to be done. You're going to do it. I'm even thinking about crossing over to that avenue a little bit, dipping in. It's like the little side
You've
hustle,
got
as
so much
Brittany call
experience.
it.
Those students would benefit immensely from your experience.
I
You should
know.
absolutely do that.
I know. I do miss that.
She's thinking, you see her, she's like,
I miss,
Well, it's, when I got into it, I've been doing it for about 2 years now. It really kind of also revigorates you as a nurse because, we're both educators in a hospital setting. So we have
Mhm.
people that are coming in generally experienced, and kind of re-upping and doing their education. But it really gives you a different perspective when you go
Right.
back to a nursing school student who's truly learning all of this stuff for the first time, and you can have like a a
give 'em a
blank slate
foundation.
almost to impart wisdom on them. And, there's
Yeah.
still that frustration that people, they're gonna learn how they wanna learn. So if they don't wanna take your advice, they're not. But if
Right.
you have a student who's literally like opens up and is like a sponge, like those students, like, oh my God,
I
they
love
melt my
it.
heart.
Fresh meat,
I was like,
honey.
I'll
Fresh
go above
meat.
and beyond for you.
Fresh
Yeah.
meat. Because they're not coming with that. I already know.
Oh, yeah.
Yeah, I did that at this hospital. I love the fresh meat because you're right. They're like sponges. They be just soaking it in, and you just
Yeah.
trying to you just giving it to them, and they just trying to take it. They taking notes. I love it because you're not gonna remember everything I'm saying. So
No.
you're like, I love that. I would much prefer a
We
student.
you gotta get her after your
Yeah,
first shift, Mary.
I
Touch
got it.
base with
Yeah,
her and tell her that it's actually really it's fun.
I need to do
Yeah,
it.
I'm looking
I
forward
I
to
do.
it. Yeah.
I need
yeah,
to do it. Yeah,
you do because
yeah,
it
because
really is like a way
I
can help the next generation. Like
right,
Yeah.
because I get
from
a
that.
little, I don't want to use the word frustrated, but I'm dealing with supposed to be seasoned nurses. They're
Mm.
supposed to already be coming with this experience. And then to find out they don't really know. And people will try to fake it till they make it. And I get it
Yeah.
on some things, but when you work in a small hospital, you can't fake it. Like you're gonna be seen. We see you. We see you. So just be honest about whatever it is that your
I
experience is.
rather have a nurse who's, 2, 3
Me
years in their
too.
career. If they came and they said and they had to do something, I'd rather them come to me and say,
I
"Hey,
don't
look,
know.
I
Can you
have
show me?
never done this procedure before. I have no idea." Because I do that today.
Me too.
There's a couple I can't I'm trying to think of something I've done, but I literally went to one of the nurses and like this guy, he's been a nurse forever. And I was like, "Dude, I've never done this in my life." And he goes, "Oh man, come on, let's go." I'm
Let's
like,
go.
"Me back, let's go. Let's go. I'll teach you how to do it." And
Listen,
so,
I've been in patient care now in 4 years, and I promise you, I'm feeling like I'm losing all my skills. I'm not doing anything. So I took another nurse and we pulled the level 1. I'm like, we're setting this bad boy up because
Mhm.
I've
Like
not
riding a
done
bike.
this in a while. You know what I mean? I'm afraid that one day I might be where I'm gonna need it on one of these floors. And
Sure.
I don't want to look crazy, but it's okay. Together, we're gonna look this up and make sure that we're doing everything right and no alarms are alarming. Like stuff like that. No shame in my game for saying I haven't done
I
this
like
in a
that.
while. I need to like practice this. YouTube, my friend too. I'm telling you,
And your fellow nurses will appreciate you
they
more
do.
and respect you more when you come to them and say, "Hey, I'm not sure how to do this. Can you refresh my memory or can you help me with this?" One, they're going to understand that you respect their experience. Two, they're going to respect that you recognize that you don't know everything and you're willing to seek help. And that's going to
Absolutely.
build trust among the whole team. So
You're
there's
absolutely
value in
right.
that.
You
So,
are. You're absolutely right.
Yeah,
Yeah.
those are great piece of advice to kind of, end this episode with because we have a lot of younger we're in a profession right now where it's a lot of younger people and it's so important to use your resources like I mean like you said Felicia's been doing this 20 years, I've been doing this almost 20 years, you've been doing this 10 plus years. We don't know everything. I don't
No,
think there's
it's always
and
changing.
and the people that do scare me so bad because you don't know everything. So like
Yeah.
you know,
And they don't ask. That's scary if you don't ask. These are people's lives we're dealing with. I need you to
exactly.
ask. You know,
And yeah, you do that one time and you cowboy something and you mess it up, you're going to lose the trust and respect
it's
of your coworker.
true. You're absolutely right, Gary. But I'm very proud of you. I love all the
Oh, thank you.
avenues in which you have gone. Like I really admire that because it was like somebody say, "Hey, why don't you try this?" You're like, "Okay, okay, okay." I'm about to say, like, Gary, what's the next thing you about to try? Like,
you
honestly,
like
like,
to
okay.
give you a plan.
I really, really like that. So, with your podcast, I do have a question.
Yes, ma'am.
What has surprised you the most since starting it?
How much work goes into it?
Yeah.
I think if you wanna do it right, I think it takes a lot more effort and work on scheduling. We all work full-time jobs. The
Right.
people that we're interviewing work full-time jobs. So
Right.
finding that common time, the editing process. Now this is might be where it's a little different for me coming from a broadcast journalism world where I did a lot of editing. I'm a kind of a perfectionist.
Okay.
So I listen to every second of that. I will pour over it. It probably takes me 5 hours to edit an episode because
Wow.
I noticed you guys use Riverside. I use
Yeah,
Riverside. It's got amazing, powerful features
thank
where you
God.
can automate it, but, like, I'm a perfectionist, and I will pour over that thing probably obsessively, more than I probably should, but it
Okay.
does take a
But
lot of work.
okay. All right.
Yeah,
Thank you for
that's
that.
that's great because we were both very novice podcasters, still are. We're
Right.
still in our
We
novice.
are still novice. We are novice at this.
And if I didn't have this platform, we would have never gotten off the road because you're right.
I mean, for
It's a lot.
novices, it's a great platform,
Yeah.
and it does make it a
Yeah.
lot easier.
Yeah. So if you're
Okay.
starting out, we both recommend Riverside. It's been a
Agreed.
great podcasting platform.
Absolutely.
Is there another one that you use other than Riverside?
I looked at the script.
Mm.
It did not have as robust a video feature
Okay.
ultimately. And my friend, John Smith, the paramedic to RN John Smith, he recommended this and he was
Okay.
actually very instrumental in getting me up and running. He had already made a lot of mistakes through his podcast. So he helped me avoid some of those.
Okay. Okay.
That's great. Yeah.
Wow.
So last thing is plug yourself, Gary the ER first. Tell everybody where they can find
Uh,
you.
Yes.
so my name's Gary. I'm the ER nurse. You can find me on pretty much any social media platform. Gary, the ER nurse, pretty much everywhere. Facebook is my podcast, which is Beyond the Call Light. You'll see my bald head and gray beard on that as well. So the face is recognizable pretty much anywhere. My largest following is on TikTok. Across all platforms, I have like 45,000. So
Oh,
we're
wow.
building. This time last year, I had 8,000. So I've been very blessed in the
You
last year.
really have.
So, and that's constant. That's just being consistent with your content, being genuine, being honest with who you are, and being respectful of other people, engaging them. It takes a lot of time to build that kind
It
of.
does.
So
Well, like I
Oh,
said, thank you so much for engaging with us and for
seriously.
on our podcast. Like I said,
So
I'm
grateful.
very
Pleasure
grateful
meeting you.
you read my message. You probably get a ton and were able to do this with us because, we're nurses. We all want to support each
right,
other. So we appreciate it when,
absolutely.
that back and forth happens.
And nurses going through things personally.
Yeah.
Yeah.
So we really, really, really appreciate
Well, I appreciate the work that y'all are doing, and that's what I like to do with my platform is to lift other nurses up that have a
absolutely.
message to share because the more voices that we can make louder, the better our profession will be. So if I can in some small way lift up a nurse who is trying to get that knowledge out, then I'm going to do that. And you know what? I've done that for a couple of people where I've helped get them out and they're bigger than me now. And I love that for them because they've got a
Absolutely.
massive voice now and they can share that knowledge and build our profession up and we all win from that. It's not a competition.
Absolutely.
We're all in this
Absolutely.
together.
And that's a great point because I feel like somebody else said it. There's room for everybody
For
in
all the
Right.
yes,
all
Yes.
win. There's no competition.
absolutely.
There really isn't a competition between us, and there shouldn't be because we can all win by banding together and being that 3 million people who go to Capitol Hill. So
Right. Right.
And we need to be.
that's a great sentiment, and you have been amazing to talk to. I'm
Yes.
so glad that you were able to come on this podcast. We're
Me
so
too. Thank
grateful.
you so
Thank you
much.
very so much. So everybody, please follow Gary. He's amazing. I love his
That's
TikToks. I
right.
found him, and he's great. So please follow him. And once again, thank you. We will see you
Thanks,
guys all
Carrie.
Wednesday.
Yes. All
Thank
right.
you all so
Take
much.
care.
Bye.
It's an honor.
Thank you,
Bye.
Gary.
Bye, everybody.